Thanks for joining us tonight for MSMA's webinar on understanding the MATE DEA 8-hour requirement. With us this evening is Mr. Thomas Sullivan. Mr. Sullivan is an accomplished leader in the pharmaceutical and continuing education industry, boasting over 25 years of experience in designing and developing clinically relevant education programs. Currently serving as Senior Vice President at Clinical Care Options, Mr. Sullivan spearheads their efforts in association relationships. Mr. Sullivan's esteemed reputation in the industry is largely due to his focus on policy and compliance issues. He is the editor and author of the well-regarded website Policy and Medicine, which is at policymed.com, which provides in-depth coverage on regulatory and compliance matters affecting the pharmaceutical and device industry. In addition, Mr. Sullivan is founder and director of the CME Coalition, an advocacy and education organization dedicated to informing policymakers on continuing education issues. In response to the COVID-19 pandemic, Mr. Sullivan played a pivotal role in establishing the COVID-19 State Medical Society Collaborative, a consortium of 30 state medical societies that collaborated to provide critical information and education on COVID-19 related issues. We're excited and happy to have Mr. Sullivan here with us tonight, and sir, take it away.
Well, thank you so much. I appreciate it. So to maximize your participation, if you want to today have any questions, just go ahead and submit them on the toolbar. Just submitting Q&A, and then after we're done, then you'll be able to additionally just hop on and just ask questions. This is trying to be as informal as we can. Spot here, hold on one second. I have multiple things going on. So we're just going to give you a little background of understanding the MATE Act, what the training requirements are. We're going to talk a little bit about the MAT waiver, which some of you may have, and then we're going to talk about the courses that are available. So the Medication Access and Training Expansion Act is included in the omnibus spending bill that was passed in Congress. That was that giant package that was passed in Congress this past year. It was intended to address the opioid crisis, to strengthen the infrastructure around addiction treatment, to equip medical professionals to recognize and treat addiction, and then also to standardize and increase the access to addiction treatment medications and training on how to integrate addiction treatment and identification into your practice. There's a training requirement that is effective June 27, 2023. It's for 8 hours of continuing education. It affects all DEA certificate holders, with exception of veterinarians. It's a one-time requirement, but given the way the government works, it's a one-time requirement now. They might pick it up again later. You just never know. Upon initial registration of your renewal or a DEA registration, it applies to 1.9 million DEA certificate holders across the country, of which 29,000 live in the state of Missouri or have licenses in the state of Missouri. And then it requires a total, again, of 8 hours of training on the management and treatment of patients with opioid or other substance abuse disorders. Let me go to the next slide. Oh, what happened? Something just happened to my slides. Can you still see them? Okay. The primary sponsors, there were none in Missouri. You can see there were both Republicans and Democrats that supported this legislation. So it received quite a few different types of folks that went for it. Basically, according to Senator Bennett and Collins, this again was a one-time non-recredited requirement for Drug Enforcement Administration controlled substance prescribers, schedules 2 through 5, to complete training on the treating and management of patients with opioid or other substance abuse disorders, unless the prescriber is otherwise qualified. And we'll go into what those qualifications are. It's allow medical schools and residency programs that would have this in their education. They're trying to encourage them to include it in their education. If there's some medical schools that are on this call tonight, we've had calls now with 4 other states, and inevitably one says we didn't have that in our curriculum. So you just need to check and make sure that you have 8 hours of substance abuse disorders in your curriculum. So why are we doing this? So as we can see, there's been 3 waves of opioid overdose abuse deaths. Basically, it started out in the first wave, which was the prescription opioid overdoses, which about from 1999 to, let's say, 2010. And then in 2010, we saw a rise in heroin overdoses. It went basically from 0 and up. Heroin has since subsided. And then what we have seen, though, since about 2013 is this incredible rise of synthetic opioids or fentanyl overdoses, and it's being added to all kinds of other drugs, and it's very bad. So Missouri overdose deaths, as you can see, have been increasing, and actually since the pandemic, they've gone up about 25%. So it's a pretty significant increase in the number of overdoses since the pandemic. So this is not a one-time, oh, we had it back in 2019 problem, or we had it in the pandemic, because in 2021, when we actually had less trouble with COVID and we had vaccines, we saw even a greater increase in overdose deaths in the state of Missouri. If you look at what people are dying from in 2014, it was heroin and a little bit in synthetic opioids. And if you look at it today, it's almost all synthetic opioids, which basically 90% of that is fentanyl deaths. So we can see that in the state of Missouri, we've seen that pretty significant increase. We can also look at age and age groups, and a lot of times people think, oh, this is affecting younger people below 24, and actually it isn't. It's more the 25 to 45, kind of the prime working years is when this is affecting more people. And we can see that among African-American males that we've seen a significant increase in the rate per 1,000 over the last couple of years, and the same with Black females and the same with white males. So, but nothing like in the magnitude as we've seen with African-American males as far as the percentage goes. Excuse me, go ahead. Sorry. If you can mute yourself, please. We have seen, I just got to admit this person. We've seen overdose deaths were worse during the pandemic, as we talked this before. And we saw, especially in this state, in Missouri, that it's really gotten quite big. Give you a little idea on Missouri drug statistics, 1,500 people die from opioid overdoses in 1 year. Prescription opioids are in about 23% of the opioid deaths, so it's still pretty significantly high. Heroin is a factor in less than 5% of the deaths. 76% of deaths involve synthetic opioids. So it's, and then other things come out of this as well, as we can see that you have hospitalization bursts. You see doctors write enough prescriptions for 63% of the residents to have at least one opioid, and 40,000 cases of hepatitis C were attributed to intermittent drug use in the state of Missouri. So pretty significant issue for the state of Missouri. Okay. Opioid crisis, also Medicare. They saw that their beneficiaries with SCC, substance abuse disorder, was increasing. So this doesn't just the MAID Act is not only about opioids. It's also about other substance abuses, including alcohol and methamphetamines. And again, we'll go into some of this in detail later. So on March 27th, almost everyone here on the call received a notice from the DEA saying that, hey, by the way, and they haven't sent another one out since, but they've basically sent out a notice and said, hey, you have to fulfill these requirements starting on March 27th when you go to renew your license. Let's keep pressing on the button. So again, beginning on June 27th, practitioners will be required to check a box on their DEA registration form, regardless of whether their registration is complete or completing their initial registration or renewing their registration, affirming that they have completed this new training requirement. And the questions they're asking are you board certified in addiction medicine? So if you're board certified in addiction medicine, you're off. Have you graduated in good standing from an accredited medical school within the US? And again, this is for US based medical school graduates of the past 5 years, or medical or dental school graduates, or NP or PA schools, and completed curriculum that's no less than 8 hours of training on treating in patients with opioid or other substance abuse, or have you completed at least 8 hours of training, inclusive or incremental, with respect to the treatment and management of patients with opioid or other substance abuse disorder. This applies to all DEA practitioners. Some people ask that. Which clinicians are deemed to have already satisfied this requirement? If you are board certified in addiction medicine, you are not required to take this. I can tell you there are all 36 people in the state of Missouri that are board certified in addiction medicine. So it's not a huge number of people. In addition, practitioners who graduated from a US-based professional school within 5 years of June 27, 2023, and have completed a curriculum that included at least 8 hours of coursework regarding SUD during that time. And also, they gave one carve out that wasn't in the law, but that the DEA and the SAMHSA, which is the Substance Abuse Agency for the federal government, they said that practitioners who previously took training to meet the requirements of the data waiver. So if you took data waiver training to prescribe buprenorphine, that can count toward the training of the 8 hour requirement. And what can count as training? Again, it's 8 hours of management and the treatment of opioid or other substance abuse disorders, previously taken courses in substance abuse disorder and the management of dental pain. And we recommend it's no more than about 5 years before. You may be able to count some states' requirements. This was from another state that we did a presentation with. Training can be classroom situations, seminars, at professional society meetings, electronic communication or otherwise. And you also need to make sure you have proof that you've had this education. There's a similar requirement for NPs and PAs. So if you have NPs and PAs in your practice, there's a similar requirement for them. In addition, SAMHSA recommends the courses to use validated screening tools for SUD and risk factors for substance abuse, including mental disorders, diagnosis and advancement of individuals who have screened positive for SUDs, initiation and management of FDA-approved medications for SUD, substance abuse disorders. That includes alcohol and tobacco, including the unique and individual physiology and medications, consideration of polysubstance abuse, and patient and family education on safety, overdose prevention, diversion control. How do you say store? How do you use naloxone? So all those are important to learn according to SAMHSA's recommendations for the course. In addition, for effective treatment planning, are you using patient decision-making paradigms? Are you doing motivational interviews with your patients? Is the impact of the stigma and trauma and social determinants of health on substance abuse and recovery? What are we doing besides just talking to the patient about this? What are some of the other things that we can do as healthcare providers? The collaboration with other disciplines to facilitate access to medications and referral services, and legal ethical issues involving the care of patients with substance abuse disorder. There's also pain management is considered part of this, assessing the patients with acute, subacute, chronic pain, components of developing an effective treatment plan, including general principles underlying non-pharmacological and pharmacological analgesics, as well as the importance of multidisciplinary treatment and interventions. The management of patients with opioid analgesics, including tampering of medications, recognizing the signs of opioid use disorder in the setting of prescribing opioids. So, a lot of very detailed information. Who can provide this training? It's listed a whole group of organizations, but including your state medical society. So the Missouri State Medical Association can provide this training. It's considered someone and also an accreditor that is recognized by the ACC-ME. There is reimbursement for screening. This is not The government understands that you as clinicians need to get paid for your time, and if you're going to be adding time in your practice to be able to reviewing patients and discussing about substance abuse and doing structured screening and brief interviewing services. There's several codes you can use for commercial insurance, for Medicare, and for Medicaid. We will be covering this in pretty strong detail during our course. But I just want you to know that you can get reimbursement for spending an extra 15 minutes with your patient. So it's not like you're just doing this complete just because that's something the government wants you to know. You will be reimbursed for your time as you treat these patients. Now, it's different than Missouri law. You know, Missouri doesn't have a pain management requirement, but it does meet 8 hours in the Missouri credit requirement. So you do have to take 50 hours every 2 years. So this will mean 8 hours of your credit requirement if you take a course. Some of you have taken the MAT training and have come under the MAT Act. The federal government has changed this, also part of the reconciliation package, and that no more patient limits for buprenorphine. So if you want to start writing buprenorphine prescriptions, you can. It does not exempt or preempt state laws for buprenorphine or methadone. So make sure you check with your Missouri state law on writing buprenorphine. I can also say, as you go to a PDMP, that if they start to see the number of buprenorphine prescriptions to start increasing significantly, that could trigger a notification back to the DEA and to law enforcement that you are writing more buprenorphine or writing more methadone. So you have to be very careful about how you bring this up. In addition, the differences with MAT is MAT applied to only prescribers of buprenorphine. It had to be verified at the pharmacy level. These are new requirements for all DEA license holders, regardless of what they prescribe. It's 8 hours, it's self-reported, and it's similar requirements for NPs and PAs, and it takes effect June 27, 2023, which is actually less than 21 days from now. Now, Missouri does have a statewide, is set to launch a statewide prescription drug monitoring program. So you will be the last of the 50 states in that union to have a prescription drug monitoring program. So I'd encourage you when they do release this, that you become familiar with how prescription drug monitoring programs work. So how does a PDP work? This is from another state, but I believe this is how it's going to work in Missouri. All dispensers providing controlled substances in quantities greater than 12 dosage units is what the typical number is of substance with a 72 hour of an individual patient. They must submit information in accordance with current transmission methods and frequency by the Missouri State Board of Pharmacy. Basically, someone walks in your office and they are asking for, and you believe they need a prescription for an opioid, you have to pull up the PDMP just to make sure that they're not getting this from one or two other places, or that you're not the third person they've seen that day. So it's just and they've seen and for instance, in St. Louis County, they saw a pretty significant drop in the number of opioid prescriptions written when they started to use the PDMP. It's like a 25% drop in the number of opioid prescriptions. If you're a Missouri licensed practitioner, excluding veterinarians who routinely dispense more than 12 units, you must report this data to PDMP as described. You're using a group called Bamboo Health to run this, and they've done this for other states, and they're doing it right now for the city of St. Louis. And again, I think there's some data issues that are happening. One second. Some people are trying to get admitted. So DEA license registration questions. If you're a multi-state license holder, let's say you have a practice in along the border in Ohio, and you practice in St. Louis and East St. Louis, you have to have multiple licenses in multiple states, but you only need to take this course one time. So it's not like you have to take it for each time you get a license. If you have multiple offices, they in those locations, you're also having to report into those multiple locations. And the DEA registration should use your work address. I was talking to one guy who accidentally used his home address for his DEA registration, and unfortunately, their home could be subject to unannounced inspections and searches. So when you go in and you do your DEA registration, even if you're thinking of moving your office, just keep it at your current office and just update it, because you do unless you're really open to your significant other having DEA come in and do an unannounced inspection, which these are law enforcement, and they don't look like the postman coming by. Cost for DEA prescriber license is $888 for 3 years. Prescribers working in multiple states must have multiple licenses. Individual states have educational requirements. You don't in the state of Missouri. There is a warning, though, that states that any person who knowingly or intentionally furnishes false or fraudulent information in their application is subject to a term of imprisonment of not more than 4 years and a fine of not more than $250,000 or both. So this is not of a faint of heart. This isn't an HHS requirement. This is a Department of Justice requirement. The DEA has stated that the subject to routine audit or complaint, a prescriber may be asked to demonstrate proof of fulfillment of this requirement. So the Missouri State Medical Association course, we have a course that meets the DEA requirements. It can be taken online. You have options where it can be slides and audio. You can do print and slides. There's also weekend seminars that you can attend. The credit includes ACCME, AAFP, AAMP specialty boards. We've submitted this to 21 specialty boards. And we also have what's called MIPS credit. So if you're part of the quality payment program, you can get MIPS hours for this as well. The cost for members for the Missouri State Medical Association is $199 and $249 for non-members if you use their discount code. And also, again, it meets the state requirements. This is just to give an idea on the program agenda. We cover the principles of controlled substance prescribing. We talk about risk mitigation strategies for controlled substances, basics of pain management, managing opioid therapy, substance abuse disorder, opioid use disorder, alcohol use disorder, tobacco and cannabis use disorder, and finally stimulant and sedative use disorder. In some states, they've seen a really rise in methamphetamines lately. So this is, I think, as good as a practice to have some background on how they operate. This is a link to the course. Again, it's clinicaloptions.com DEA Resource Center. The course registration and they have frequently asked questions. We've been doing several of these seminars, and as we ask you questions today, if you come up with one we don't have in the FA and the frequently asked questions, we'll add it to the website. In addition, there's linked to websites with patient materials. So a lot of resources that are available to you. There's two ways to take the course. You can do live webinars. We're running those every single month. So if you wanted to just take a day off and just finish this off and do a live webinar, that's one way you can do it. Or you can take on-demand courses. So it gives you kind of a nice option to come in. Again, this is the website to get into the resource center. These are some additional background on the MAID Act, some policy, some notices from the DEA, some FAQs from that we put up from Clinical Options. In addition, we have some policy and medicine articles as well. So I'm going to open this up for discussion. And if you want to, I see in the chat, we have several. It says, let me go back to some of the early ones. When do they arise? Is the DA necessary for one's practice? Is there any need to continue or renew to hold one? That's a good question. I would say yes, that there are, if you do any controlled substances, if you write an Ambien script for someone, if you you do any antipsychotics, if you do anything that's considered a controlled substance, you do need to have a DA license in order to write that script. Anyway, and you can let it expire, which is one way to do it. The state of Missouri does not have a PDMP state. St. Louis County started it. I believe other counties have opted in, but not all. Yes, but the state does have a law on the books that they have to have a PDMP, and it's supposed to be implemented sometime this year. So that's why I covered it in the discussion. Yeah. Unfortunately, you do have to pay for a course. I see that. Can you put the link in the chat? Yes, I can put the link in the chat. Should the DEA annual fee be covering this? That's something to talk to your congressman about, because right now the DEA is not covering. It's not covering this. Is there any? There are other areas that have them. There are other courses that are available, and you can find them online. Yes, and I'll put all those links in the chat. Yes, I can give you my email address. It's on my last slide. I'll get that in a second. I just put my email. And I'll put the articles in the chat as well. Anybody want to raise their hand and ask a specific question? I see several people are joining. What if a person's license expires right before the 27th? Well, the good news is you have 3 years now if your license expired right before the 27th. So you have 3 years to fulfill this requirement. Would the AMA organization lobby your Sackley family to pay doctors for these courses since they conveniently avoided bankruptcy? Actually, they did go through, I don't know about the Sackler family, but they did go through bankruptcy. That is correct. Or at least their company went through bankruptcy. I will clarify that.
So are there any states that show decreased utilization of opioids with this program in effect? I mean, what is the data on that?
So there has been data that has shown that if you have education, so understand this program is actually less about writing opioid treatments and more about treating substance abuse disorder. So the real thought of this is when physicians and physician assistants and nurse practitioners and dentists went through school, they had no training on substance abuse disorder. And that was sort of the case that they made. So I know we're focused a lot on opioids, and we do, our course actually covers, I'd say, about half on opioids and half on the other substance abuses. But it's really, but the motivation for this was about substance abuse disorder. Now there are studies that show that if you get education, you will be more likely to be more cognizant and utilize, for instance, when they saw that the REMS education for which the FDA did on opioid treatments, that they saw that the numbers went down, but in reality, it's not all the same. It says my family residency required a substance abuse rotation. I thought that was standard for family practice medicine. It probably is for family medicine, but it wouldn't be if you were a surgeon, or if you're in one of the internal medicine. I don't think goes through a rotation on substance abuse. I think it depends on the school that you went to, that you took your residency through. Kimberly, did I answer your question?
I just wish there was some more robust data about this when we're asking our physicians to do more education. I mean, I've been in emergency medicine for 35 plus years and am quite aware of how to take care of acute issues and to not write opioids on acute pain management because of the addiction probability. So to me, it just makes it more complicated for physicians to keep up with what they have to do every day. So I'm just a little disappointed that there's not solid data that shows that this is effective in helping those who need substance abuse disorder treatment.
Yeah, no, I feel your pain on that one. You gotta understand when Washington passes bills, typically what they do is politicians react to scenarios, things that happen in their district, as opposed to any data. So, when someone runs and gets hit by a light or they get killed by a drunk driver, that draws a lot of attention as opposed to, well, there's really a problem in that area. So understand a lot of times policy has nothing to do with data, but we will have data to show one way or another at the end of this if this actually does help with substance abuse. If people start to utilize the code, for instance, for substance abuse counseling, I think that you'll see a big uptake, and a lot of that will be because of the training that they've received. For advanced practice providers, can you use the education approved for CME, or does it need to be approved for their specific CE? Actually, the course with the Missouri State Medical Association has AANP and AAPA hours, so that is not a problem for you. But physician assistants typically can use ACCME accredited courses, and nurse practitioners have to use AANC accredited courses. So it's just kind of the way that lays out. Will the slides in my webinar be available? Yes, my slides will be available. We'll send them over as soon as this is done over to the State Medical Society. Anyone else with questions? We have a few minutes. Oh, I see one more. Okay, let me put the links back in the chat. Okay, hold on a second. The links back in the chat. Someone asked about my contact information. I'll put that in there too. Does up-to-date articles count if it's 8 hours worth of them and it's on substance abuse disorder or pain management? Technically it could. You just have to keep a record of when you took it and how. Does it have to be an 8-hour course? No, you don't have, it's not it's incremental. So you can take 3 hours a course, 2 hours a course, 1 hour, whatever you need to make up the difference. That's kind of the way we also designed our course, is so that if you needed just to take up 3 or 4 hours, you could just take that, or you could take the whole thing.
Can anyone see the links? I'm sorry, I see you copying them, but I can't see the links.
Are they not showing up? Oh, you know what? To waiting room participants. What the heck? That's the weirdest thing. Hold on 1 second. I can't, let me try. Oh, you know what? I have it set everyone. Okay, you know what? I totally apologize. I keep copying and pasting them. And and I was set to waiting room participants. Don't ask me why. Here you go. I am totally apologize about this. I am new to Zoom. Trying to run one of these myself. Did you see my questions above, Jeff Copeland? I'm passing you by, Jeff. If I download a course, can I take it at my leisure, my conviction time? If I don't have to renew a DA license this year, is it okay to wait until the year of the renewal to do this? Yes, it is okay to wait for to wait for your renewal, and it's online. I'm not sure you can download it. I'll have to ask our tech people. I just don't know the answer to that question. But you can basically, anywhere you have an internet access, you can take it. I would just say I wouldn't try to put it till the week it was due, your license is due, but try to do it at other times. I saw there's a PDF available. I know I have that in the slide. There is not at this time a PDF available, but we will be making one available in the near future.
Any other questions for Mr. Sullivan before
Does
we?
everyone have to take the course? No, there was a clear exemption that if you had taken the Suboxone waiver credit, then you were exempt. If you took it over 5 years ago, I would say you want to keep within 5 years just to be current, because a lot of things change in medicine over 5 years. But if you have proof of that Suboxone waiver, you should probably be okay. But not everyone has to take the course, but many people will be required to take a course in order to fulfill this requirement. Does that answer your question, I hope?
Tom, there was a question about do the up-to-date articles count? Did you get that question?
Yeah, I did. I answered that yes, they would, but you do have to you need to keep track of that, right? Because in up to date, you're just reading a little article, it's 15 minutes, and you'd have to keep track that you took, like you'd have to put them all together and keep it somewhere in a file. So if you are ever audited, you have a file showing that you have them. That's all. Do we have to pass our training by anyone to get them approved to count toward this requirement? No, you don't have to pass them, but they have to be from one of the listed organizations. And I can go back to that slide. They have to be from one of the listed organizations. You can't, it just can't be an article you read. It has to be from someone on this list. And it's a pretty robust list. But for instance, the American Academy of Family Physicians isn't on the list. And they have their own credit system. You're accredited by ACCME. Yes, your trainings would count on that. Okay, so you're not clear on who has to take the course. So it's a course. Any person who, as your DEA license becomes up for renewal, you'll have over the next 3 years, any person that's license comes up for renewal, unless you are board certified in addiction medicine, or you have taken the MAT waiver training, or you have had a course in your medical school for 8 hours that covered substance abuse disorder, then you won't have to take the course. But everybody else is going to have to take a course or a series of courses to get to 8 hours to be able to fulfill this requirement. How do you get the discount? The Benita, can you address that?
Yes, the link for the discount, you have to log into your MSMA account. and you can get the discount code as a member. The non-member code is on our website. And you also have to set up a CCO account, the clinical care option, to access the educational.
Right, because that's part of Benita, that's part of the registration process. So it's adding that they just want to know what your specialty is. So make sure. And I would also say that if you are a foreign medical school graduate and you took 8 hours of course in your medical school, that's not going to count toward this requirement. It's really for just those who had a US requirement. Yes, will you send her an information? Can you send out everybody who's a member? You're going to send out members information on the course soon, correct? Benita? This is someone who knows, will you send out information on all this? On the course?
Yes. We have been sending out emails and we will continue to do that.
Okay.
If there are no more questions, thank you, Tom. And Tom is going to share this PowerPoint and we will put it on our website as well.